from continuation of the last class, I want to discuss about now the abnormal labor. And I will show some assisted vaginal delivery, that is venous delivery and forceps delivery. Video presentation after that. And then some other management. Okay. So, what is abnormal labor? That is away from normal things. Is it not? What is normal things in labor? If you think the labor process, that is, what is this? There is uterine contractions, progressive dilatation, descent of the fetal presenting part, and then delivery. So, any deviation from these three processes, any deviation in time, in power, in the way, that is in the passage, in this problem in the passenger, that is called abnormal labor. Okay. So, if you think that contraction, from where contraction starts? Uterine fundus, fundal dominant. Fundus, actually the source of contraction starts from the fundus. And then it causes progressive dilatation of the cervix. So, gradually you remember that contraction, the intensity of the contraction gradually increasing. At first 5 to 10 millimeter mercury, then what? 40, 50 millimeter mercury, then lastly even 100 to 120 millimeter mercury pressure. So, if this rhythm not maintained, suppose contraction starts only 10 to 15 millimeter mercury and then no other contraction, that is no intensity, not gradually increasing. There are so many causes for this. So, it also causes abnormal labor. Why? It takes long time. It causes maternal exhaustion, it causes fetal problem. So, it is abnormal. So, I told about the power. And if you think the passenger, who is the passenger? Fetus is the passenger. So, if you think the fetus is the passenger, there is a term capulopelvic disproportion. You know the capulopelvic disproportion? Disproportion is between the pelvic cavity and the fetal size. Fetal size may be problem in the fetal head, may be problem in the size, may be problem in the position, may be problem in the lie. So, that is abnormal presentation, abnormal position or abnormal lie. Okay. And also there is anomalies, fetal anomalies, you know, sometimes fetal anomaly, hydrocephalus or sacrococcygeal tumor or conjoined twins, like this, fetal ascites. So, it may cause also problem, that is cause of abnormal labor. Another thing is passage. Passage, what I say, what is passage? Birth canal. So, if you think this birth canal, the fetal can at first fixed engagement, I told before last lecture, descent, and then there is rotation, about 7 rotation, internal rotation, descent, external rotation, then crowning, then extension, then delivery. So, for this region, pelvis cavity must be what? Sufficient, must be adequate. তো আরেকজন কোথায়? ও জানে না? আচ্ছা আচ্ছা, তোমাদের একটু পরিচয় করে দে। ওরা হলো আমাদের পোস্ট গ্রাজুয়েশন স্টুডেন্ট। লাস্ট ক্লাস ওই ইন্ডাকশন ক্লাস, this is Dr. Ismat and Dr. Tamanna. They will accompany with you regarding on the lecture class. Okay. So, welcome to our class. Okay. So, pelvic inlet, you think the pelvic inlet, there is standard diameter. What is the standard diameter here? There is anteroposterior diameter, then transverse diameter, oblique diameter. There is fixed measurement. Anteroposterior diameter, can you remember? 13 maybe. And transverse 12, and like this 11.5 centimeter oblique. And pelvic cavity all 12 centimeter. And outlet here, anterior posterior more. I told last class 13 centimeter and this one. And you see the outlet assessment, what we do by the outlet assessment, subpubic angle and bitrochanteric diameter. Here bitrochanteric. It is skull tuberosity, there is femoral, in the femur there is trochanter, greater trochanter. And here we fist, we can, in the living body we can assess where is the, in between thigh, the knuckle of the fist can pass or not. Okay, and other measurement also, there is some other measurement. And most important is the ischial spine. This is the dirustation of the fetal head. If dirustation of the, that is biparatal diameter crosses, then we told that the zero, that is +1 station. Above this, minus station. Okay. Now, if some different regions, congenital or acquired, some growth and development defect of the, that is from the, if you think the intrauterine life while I am in the mother uterus, then developmental problem, acquired problem, there may be some diseases in the pelvic cavity, yes or no? Yes. So it may be affected. My nutrition, my work, my development activities, you see my exercise, and different, so many environmental factors, genetic factors, it can affect my body size and also the pelvis. So pelvic, it may be contracted pelvis, it may be deformed pelvis. Sacrum may be some problem. So this anatomical inlet, cavity and outlet, deformity or contraction, it may cause also the abnormal labor. Labor may be arrested, labor may be protected. Protected means slow progress. Protected labor means so slow progress. Arrested means no progress, no progress. So these are the two terms in the labor, protected and arrested. Okay. Now we can go through the, I will show some the abnormal position. Normal position, what is normal position of the fetus? Occiput anterior. This is occiput. They do not give the fetal head. So this is occiput, okay, and then this is face, this is brow. So now normally occiput anterior position, you place like this, and the position is here. So this is normal, okay. Why it is normal? Here you can imagine suboccipitobregmatic, that is diameter of engagement is less in this way. If in this way, then diameter would be more. So it would be difficult for the, so different diameter in the fetal head. Suboccipitobregmatic, the normal, occipitobregmatic, mento-anterior, so many in diameter of engagement makes the different position. So it is a standard position, but if it is slightly partly extended, it makes another position and it will cause prolonged labor. And if it like position, it will what is brow. It is maximum diameter of engagement and it causes it will come easily or not? Not easily. So it will cause prolonged labor and then obstructed labor. Okay. So brow, and if like this, then what is the presentation? Face. Very good. The face, this is the denominator is mentum. Mento anterior sometimes and sometimes mento posterior. If you rotate this on posteriorly. So these are the different position. Okay. Now the another commonest abnormal position is occipito-posterior. Occipito-posterior. So in the written exam, it will causes the occipito-posterior outcome of the, you can write the outcome of the occipito-posterior. That is most common abnormal position. Sometimes it is also called presentation. Anyway, so if like this, so what would be the outcome? So labor will be prolonged, difficult labor, it will take long time, As why it takes long time? It cannot deliver in this way normally. Normally at the level of the gestation, fetus always try to rotation. She needs long rotation to be what? Occipito anterior. Labor, not like this labor. If she passes this passage, she should rotate totally anteriorly, occiput. So need long rotation. So in the long rotation, it is not so easy. It may be arrested at any way. Where incomplete rotation, like this, if like this, is a transverse arrest of the fetal head. That is, fetal head is in between the ischial spine, fetal head is arrested. That is called transverse arrest of the fetal head. Okay? So that is, what will be? It will cause prolonged labor and ultimately obstructed labor. Ultimately, it will cause obstructed labor. It is one of the commonest obstructed labor. Commonest cause is deep transverse lie. This transverse position of this fetal head. Okay. Now this is so. These are the outcome. And ultimately, if there is rotation, sometime possible, and normal delivery also possible. If good contraction, pelvis adequate, no maternal exhaustion, then after long rotation, it is possible normal delivery. So these are the different outcome of the occipito posterior position. Incomplete rotation, prolonged labor, deep transverse arrest, and complete rotation and delivery is possible. Okay. So then another abnormal presentation. What is the common? Breach. You know the breach presentation. Fetus buttock is in the pelvic inlet. So this is the breach presentation. In breach presentation, that is, so this is a complete breach like this, complete breach, totally flexed breach presentation. And sometimes fetus may come in leg extended like this. Back should be anterior or posterior. Always think the natural way, which is better. Anterior, of course anterior. So the extended breach. And this, if fetus lie in this mother, then it would be foot limb presentation. So flexed means in the at the region of the knee flexed. Okay, all body flex, complete flex. Then extension, extended breach, then foot limb presentation. It is so difficult. Foot limb presentation, always indication of the cesarean section. Okay? And another thing is baby may lie in this way in the maternal abdomen pelvic cavity. Maybe or may not be. In the uterine cavity? Maybe. What is the name? Transverse lie. If transverse lie, then presentation what would be? Shoulder presentation. Like shoulder presentation. Shoulder, so if shoulder presentation like this, is it possible delivery? No. So fetus, if neglected, not diagnosed before, mother is at home trying, so what would be the outcome? Outcome is obstructed labor, that is dry labor, difficult labor, maternal exhaustion, fetal stillborn like this, and the fetus try always to come out. So what is the small part here? The hand. So hand will come at first. So what is this? If hand come, hand prolapse. This is called, if hand passes through the vaginal cavity and cervix, then it is called hand prolapse. And then what hand prolapse, and so how you deliver in this position? Cesarean section. Even nowadays, before in our period, earlier period, that is, we are destructive. If fetus die, then we do destructive operation. That is, here we do some evisceration, we puncture here, we come out all the viscera, and then we put hand under anesthesia, and the internal podalic version, we hold the leg, and then we bring the fetus, dead fetus, that is internal podalic version and extraction, breech extraction. there is two terms, internal, that is inside, so internal, as I hold the leg, so podalic, and I am rotating the fetus from transverse to longitudinal, so version from transverse to longitudinal, so internal, podalic, version, and if I bring the fetus as a whole outside, so it is called extraction. So internal, podalic, version, and breech extraction. Okay. So this is one. Another is cesarean section. Okay. So these are the some abnormal. Another is compound presentation. Along with presenting parts, if any parts of the limbs, suppose fetal hand comes in front of the fetal head, or anyway lower limbs comes in front of the fetal head, that is called compound presentation. Understand? Any question regarding this position and presentation? So all these will create the abnormal labor. So in the power, in the passage and the passenger, all will cause the difficult labor. That is also called dystocia. There is a term dystocia. Dystocia means difficult labor. So all these terms are difficult labor. So another protected, but I told protected labor and arrested labor. These are the some terms. Okay.